I found myself really recommending over Kybella more and more. I had the definitive experience with a patient where I was like, that's it, I'm not doing this anymore. I'm Dr. Kate D, founder and medical director of Glow Medi Spa. And this is Med Spa Confidential, where we expose the risks, the red flags, and the outright illegal practices happening inside med spas right now, because you deserve to know who's treating you, what's being injected, and what happens if something goes wrong. This is my first in a series of podcasts about why I say no to patients. So there are lots of things that are offered in the aesthetic world that I just don't agree with. Either they shouldn't be done at all, or their patient selection has to be very, very careful for it to be an appropriate thing for that patient. And I am often asked, like, what's a main reason that I would turn someone away? And so I'm going to start with Kybella, because I think that generally Kybella shouldn't be used at all. And I'm going to tell you why, and why some places are still offering it. I actually have no idea, because it basically doesn't really work. But let's go back to the history here. So Kybella was first FDA approved for dissolving submental fat, meaning the fat under your chin, back in 2015. And it happens that I opened my spa in February of 2015. I believe Kybella was approved in April of that same year. And immediately I was approached by the reps involved, and they wanted me to use it and all this. And there were good studies saying that it worked, and I believed them. And actually, a really respected colleague of mine is a dermatologist, and I just really respect her opinion. She was part of the initial studies. And I thought, okay, great. We all would love a solution for the fat pad here. And if you could do that without liposuction, fantastic. That'd be great. I was an early adopter, and what it involved, so Kybella is deoxycholic acid. It is a bile acid. So your liver makes bile, and it, among other things, dissolves fat so you can absorb it. So what happens is you secrete this deoxycholic acid as part of your bile, and it helps you digest fat. So what they were using it, where they purified it and then injected it into areas of fat that would break up the fat cells. And then ultimately over time, the fat would be broken down, and it would go into your lymph system, and it would over time be metabolized, and ultimately you would excrete it. Okay. It was a series of injections into the fat of the submentum. The only FDA approved use of this was the submental fat, the under chin fat. And so a bunch of injections under the chin, and then it kind of hurt right away, but that didn't last too long, 5 to 10 minutes, pretty stingy, pretty unpleasant. And then it would swell up like a bullfrog. And that part really took a couple weeks to totally go away. Pretty noticeable. You could see someone walking around, and it was just very, very noticeable. Usually after the first 10 minutes of pain, it didn't feel good going in. I never had it done to me, but we did many patients back in the day. And then pretty much there wasn't long lasting pain. It was fairly short-lived, and you could get people through it. We used ice packs and stuff like that. There also was a fair amount of bruising sometimes, not always, but sometimes there'd be bruising. And that would take a little while to go away. Like any bruise, it turns purple and yellow and goes away. So the idea here was that you would do all of this, you would go through all of that, and ultimately some percentage of that fat would be metabolized and eliminated over time. It took a while, because you're not sucking it out of the body. You're waiting for your body to process it and excrete it. Okay. So all the studies were done with a series of treatments. And the mantra was back then that it would take somewhere between 4 and 6 treatments to really get rid of a prominent submental fat pad. Well, so we were warned also that if you were a little older, like maybe like me, so I'm 58, people with lax skin already, if you remove the fat, that maybe the skin would be not tight enough, not springy enough to spring back and stay up. So the idea was, if you took the fat away, you still might be left with some loose hanging skin. It won't look any better. But the idea was that a younger person had springy skin, and you would bounce right back and it would look great. So that was what we thought was going to happen, that people would need a series of 4 to 6 treatments, and that some people, especially if they were older and had lax skin, might not get the best results. So what I found in practice after doing this for several years on a wide range of ages of people, it was that some people responded pretty well. Most people responded a tiny bit, and a big chunk of people didn't respond at all, despite how many treatments were given. The other thing that wasn't predictable was the amount of fat and the amount of treatments needed. So, and that I thought was a little weird, but if someone had a lot of fat, you'd think it would take many, many treatments. If someone had a small amount of fat, maybe you wouldn't need as many treatments, but I didn't find a correlation. It seemed like some people with only a small amount of fat needed way more treatments. And we could never determine how many treatments would reliably treat the fat, which meant that you could never know how expensive this thing was going to be. Kybella was very, very expensive. And so if you needed 5, 6, 8 treatments, that was a lot of treatments. That was very, very, very expensive. And with a lot of downtime, because each time you're a bullfrog, each time you might have some big bruising, each time you're walking around like this for a couple weeks. And so really, like, if you needed that many treatments, you could be paying many, many thousands of dollars and have many, many weeks of walking around looking really weird. And what I found was, I know some really great plastic surgeons in my area, and the whole experience of doing liposuction for the under chin fat was just so much simpler. It was one and done. They could pretty much guarantee they could take out all the fat there. This is not a super hard area to do liposuction. Very different from other areas of the body, which liposuction can be hit or miss depending on the area. And I'm not a surgeon and I'm not an expert in liposuction. I've had many patients go for liposuction over the years. But in general, I think of the submental fat as being kind of the easiest place to do it, not being the person who does it myself. But anyway, so over time, I just found Kybella to be extremely expensive, have a lot of downtime, a lot of negative side effects, and I could not guarantee that they would be happy with their results. And it became very much like a long conversation before I would even consider doing it to anyone. And over time, I found myself really recommending liposuction over Kybella more and more. And then I had the definitive experience with a patient where I was like, that's it, I'm not doing this anymore. It was this lovely patient. She was 32. She looked great. She had this little focal fat pad that she absolutely hated. It was pretty small. And I thought, well, she's the perfect candidate. She's got young, springy skin. It's pretty limited. How many treatments could she possibly need? And we went for it. Okay. And she didn't have a ton of money. She was 32 years old. And I was like, well, if anyone's a good candidate, it would be her. And unfortunately, she had 3 treatments, all of which were unremarkable. She tolerated them just fine. But she came back super nice. But she was like, you know what, Dr. D, I don't see a difference. Can you take before and after? Can we look at those? Like, it doesn't look like anything happened to me. And she came back and I examined her. And indeed, like, she really did not have fat there anymore. The fat was clearly gone. But when we did her before and after pictures, the skin hung in exactly the same spot it hung before. It was just looser. There wasn't puffiness there. It was just hanging there. And I was like, there's no reliable way to know if a med spa is following safety standards or cutting corners until now. The Med Spa Board certifies clinics that prove they're doing things right, verified products, licensed staff, and actual medical oversight. It's the difference between rolling the dice with your skin and knowing exactly who's holding the needle. If you're looking for aesthetic treatments, go to medspaboard.com to find a certified spa near you. And if you already have a med spa you love and they're not certified yet, please send them our link. Med spa owners, getting certified does more than build patient trust. It should also save you a ton on your malpractice insurance. Do the right thing and go to medspaboard.com. Keep listening, keep asking questions, and stay safe out there. Oh God, I felt terrible, okay? And she was really understanding and she didn't get angry. It's just she felt like it was a big waste of money. And so did I. I felt like it was a big waste of money and a waste of a procedure. And that was for me the straw that broke the camel's back. I stopped doing Kybella at that time. And I remember absolutely distinctly, right at that exact same moment, I had a brand new consultation on my books for Kybella within that week. And it was still on our website. I felt bad, but patient showed up for this consultation. And basically, I explained to her everything that I've just said about our experience with it and why I thought that it just really wasn't appropriate anymore. And I was going to take it off of my list of services. And so this person was actually quite upset with me. She really wanted it. She had done her research and I didn't want to do it to her because I felt that if I did something to her that I didn't think was right, it's essentially assault. I mean, I don't think it's the right thing to do. I don't think it's the right thing to do basically for anyone, really, because you just can't guarantee what the outcomes are going to be. And it could potentially be ridiculously expensive. So if we had, I guess, that whole conversation and the patient still wanted it, I suppose, like, I'm not saying that every single person who does this to any patient is in the wrong. I'm just telling you why I cut it out of my list of services. I do not offer Kybella. I have not offered it in years. And when I see new providers at med spas offering Kybella, I question whether they know what they're doing. I question whether they've had any experience with it. I think a rep got a hold of them and sold them Kybella and the results, just like they convinced me in the beginning that it was going to be worthwhile and it's something they needed to offer because they don't want their patients to go get liposuction somewhere else. And I just disagree with that entire reasoning. I think that, you know what, if liposuction is cheaper, faster, more reliable, even though it's more invasive, I'd rather have liposuction. And if I would rather have that for me, I would rather have that for my patients. So that is why I say no to Kybella. I'm not saying it's unethical at all to do. I just don't want to do it myself. And I don't think the vast majority of providers who are offering it really have reasoned this out. So that's my opinion on Kybella. Take it or leave it. I'd love to hear if you're a patient who just loved it and it was the best thing in the world. I'm not surprised. It's possible. I would also love to hear if you had it and it did nothing. And for providers who are still offering, and if you're offering it for years now and you have lots of experience with it, tell me your experience and how it was different from mine. Thanks for listening. If this episode opened your eyes to something you didn't know before, share it with someone who needs to hear it. Subscribe so you don't miss the next one. And drop a comment telling me your biggest takeaway. I actually read them all. Join me on this mission to keep you safe and push this industry to do better.